So, welcome. We are about to interview one of my most favorite people. This is Jordan Kocon, who is a student presently at NMSU, but he's about to move to Rochester, New York to work on his PhD clinical practice. So before he left, I wanted to make sure I had an opportunity to sit with him and introduce you to him and interview him, because he's a very valuable member of this community, and I hope he comes back at some point.
So do I.
And shares his incredible wisdom and sensitivity with the community. So I want to turn it over to you to give us just a little bit of an introduction, like who are you, where did you come from, and anything else you'd like to share.
Certainly. Thank you so much, Dr. Chavez. So my name is Jordan Kocon. I'm a fifth-year doctoral candidate at New Mexico State University. I am coming to the final stages of getting my PhD in counseling psychology. And as you had mentioned, I'm just about to leave this lovely, enchanting town of Las Cruces to move to Rochester, New York to complete this clinical internship. So I came down to New Mexico to complete my graduate studies. I'm initially from Minnesota. And the reason why I chose New Mexico, and more specifically New Mexico State University, they were a graduate training program that offered to support me in the education that I was privileged to have growing up with learning Spanish at a very young age. And so New Mexico State University in the counseling department, they have a graduate minor in Spanish counseling. So what that means is, in addition to receiving the education, the training, the mentorship, clinical opportunities to work in a counseling setting with English-speaking individuals, they provide all of those experiences and training in Spanish. And that is a really rare feature of graduate studies programs right now. And that was something that was really important to me, to make sure that I would not squander the gift that my parents offered me, that education to speak another language. And so that brought me here to Las Cruces, where for the past 4 years I've been completing my coursework and my education and working in the community in various therapeutic settings, so outpatient, private practice, within the school systems. And it's with a heavy heart that I will have to leave this space for a little bit. I'm not looking forward to returning to the cold. That's going to be a little bit rough. But I'm really excited for this opportunity. And
absolutely.
I am first and foremost really grateful and humbled to be invited here to speak with you and to speak on this topic. And so I hope that as the conversation continues, that it provides a lot of benefit not only to you, but also to the patients and prospective clients in the future.
And that's actually why I invited you. In the last 20 years since I've been working with medical cannabis patients in this area, I noticed that there is a big gap in terms of mental health care for patients, especially patients who use cannabis. There's so much misinformation, there's just lack of research, there's a deficiency of practitioners, and I find that you in particular have a very balanced approach to what you're about to embark on in your life as a career, as a mental health practitioner. I think because you're young and you're open and willing to explore the needs of the community, and especially cannabis users. I know you're not in private practice yet, but you've been researching and doing your due diligence, and you know that, and I think you'd agree with me, I should say, that cannabis is not for everyone, and that those who do use it, just as a part of the responsibility issued upon them as a user, that we need to help people learn and be guided. Because we were just talking earlier, you and I, about why it is that people can get their medical card with no guidance whatsoever The rules of the Department of Health are very clear. You're supposed to have an established relationship with the patient for a reason, because everybody's different, and some people are on other medications. Some people don't even know how to use it, and there's this whole lack of guidance and education. So, in your case, as a clinical, you're going to be a clinical psychologist. There's a big difference. So let's talk about that. And from your experience, what is the difference between, well, before we do that, are you in agreement that guidance and education is vital to the use of cannabis?
It is critical. Cannabis, like any other medication, Xanax, Prozac, the statins for blood pressure, they need to be monitored. They need to be prescribed by a medical doctor. They need to be monitored. And of course, education and guidance and counseling is really important to maximize the therapeutic potential while also safeguarding and reducing the likelihood for harming ourselves.
Yeah. In terms of your future as a practitioner, you see a great need for guidance and education, but you do know that in New Mexico, the medical cannabis program, the certifying practitioner does not prescribe cannabis. Basically, the certifying practitioner's role is to support the user because the benefits of cannabis have been proven to outweigh the risks. However, from my point of view as a practitioner and working with cannabis patients for over 20 years, I find that mental health is necessary and efficient. Would you agree?
It is, and even looking beyond like mental health and those who use cannabis, there's a deficit of mental health practitioners and even access to some of these services, especially in a place like here in Las Cruces in the borderlands where there's a lot higher needs. It is a very complex and nuanced environment, and so the needs of Las Cruces, of course, are going to be different than the needs of New York and the needs of Minnesota. But universal across all these spaces is there is that vital, not necessity, but recommendation that everybody should have a therapist. Therapy is a wonderful tool to be able to support human beings, and especially when we're receiving psychotropic medications, something like cannabis, it's even more important to make sure that we have that support and a care system to provide help and aid when we are struggling.
Precisely, and we live in a very stressful world. I don't know anyone who doesn't have stress, and since COVID, that has also been kind of people went into depression and anxiety, and the social structure just was very delicate at the time, and I agree with you that cannabis is a medicine, and it's not just for fun. I mean, there are recreational users. Many of us started as recreational users. However, it is a medicine that has to be treated with that kind of respect, because not everybody's going to react to it the same. There's going to be people who have bad experiences, and I want to touch on anything you care to share about the youth, teenagers up to 25, 30 years of age, and how quickly they are changing over to using vapes and cartridges, which is not the old-fashioned flower medicine of our youth. Now it is a very strong drug with 99% THC sometimes. Do you want to touch on that?
Absolutely. And so circling back to what you said in the beginning, that cannabis is not for everybody. While it is a medication that's been present, and there's a lot of evidence both in the United States and globally going back thousands of years of its therapeutic benefits, it can be harmful for certain people.
Yep.
And especially for young growing minds, our adolescent youth. So one of the things that is really important to note is that our bodies are not fully developed when we turn 18 and we're in the eyes of the state or the government all of a sudden an adult. Your brain continues to grow until well into your 20s. I think some of the research cites that your brain, the last lobe to develop, your frontal lobe, where we use to make decisions, organize data, critical thinking skills, restrain our impulses and our urges, that doesn't stop growing really until around the age of 25. And cannabis is a drug that impacts our brain. There's been studies that have shown it impacts our memory. And speaking of specifically adolescents, there was a review that was done in, I want to say there's been multiple reviews, but it talked about, using cannabis, like chronic cannabis use in adolescents can impact the development of certain mental health conditions like depression, anxiety, and even some studies have shown it can be associated with increased suicidal thinking. And so it is extremely important to be aware of this information, because some people think that, well, it's a plant, how much harm could it have? The truth is, while you may not be able to overdose on it like something like fentanyl, for instance, or opioids or stimulant medications, it is very harmful, and the lack of research is a huge problem right now, because we don't know what we don't know. And granted, all kind of the information I talk about and share today that is research, that is subject to change. The scientific process is all about replicating studies, doing the investigations, and as we gain more information, it gets updated. And so what I'm saying today might be different in 1 month, 1 year, 10 years down the road. There's a reason why in a lot of, for instance, in the PhD program, when they're encouraging us to use research, to only go back 5 years, 10 years maybe at the most, because so much has changed in that time.
That's right.
And so particularly with adolescence, where your personality is developing, your body is growing, you have hormones, your brain is a confluence of all these different drugs and neurotransmitters. And so something like cannabis could have a very harmful impact on a developing brain. And we don't know to the extent of that because there aren't very many longitudinal studies. And that means that you're working with the same group of people over a long period of time. So it could be 6 months, it could be 10 years.
So that brings up a question in my mind. Do you know of any research that has been done in teenagers? It seems like what we hear is that teenagers start experimenting with drugs and cannabis generally around junior high. Sometimes sooner, sometimes earlier, but excuse me, generally around junior high. So do you know of any research that has been done as to what it is that might be happening in those young brains that they find themselves attracted to the use of drugs?
Sure, yeah. So I've got my notes here that will help kind of back up and ground this in the evidence. So there's a lot of reasons why people might engage in cannabis use around that time. So it could be risk-taking behavior. They might want to try something new, something exciting. There's the cultural taboo of, oh, I'm doing something bad. This is cool. As we both know, there's very much a strong prevalence of cannabis use in mainstream media, within movies, within pop culture, within music, that promote kind of the use of it without talking about what we're talking about, the health implications, the public consequences, both socially, psychologically, and physically. And so there is research that talks about some adolescents might be driven to use cannabis to, for instance, to fit in, to help make friends, to help maybe cope with depression, anxiety, pain, trauma. There's other research that has talked about adolescents being using cannabis because they were encouraged to do so maybe by someone within their family. That, oh, well, it's just a joint. Like, it's, what harm could that do? Similar to maybe how some families might be turning the other way to drinking at that age. So there's quite a bit of research that would support the notion that adolescents are using cannabis or exposed to cannabis in a variety of settings, in a variety of different ways. But again, it's always changing. And so it might be different for youth these days right now, where we've got stuff like vape pens, for instance, which might be seen as something less harmful, for instance, than maybe smoking a joint, for instance.
The thing about vape pens and cartridges that I kind of find interesting is that many of the users that I speak to, they tell me they use it because it's a good way to be discreet, and they can get stronger dosages from a couple of hits of a vape pen. So that's something that also we need to address, is that the cannabis of today, and especially in vape pens and cartridges, is very strong. It's not the same stuff in the 60s that was maybe 5% THC. Now it's like 99% THC. So not only are you getting the cannabinoids, but you're also getting solvents and propellants and other ingredients that are used in extracting the medicine. So yeah, that has a great impact on the brain, and especially the young brains. So there's got to be more personal responsibility. The way I look at it is, my job is to inform the patient, educate the patient, but it's up to the patient to be responsible and to know what it is that they're ingesting, and that there are different effects from the way you ingest it. If you smoke it, if you eat it, if you drink it, if you apply it topically. You know, in the past, drinking alcohol was socially acceptable. It still is. So most people do that. But now the complication happens when you mix alcohol and cannabis. There's this thing called the greening effect. I don't know if you've heard of it, but that's when you mix them in a social setting, and then you start having side effects like nausea, vomiting, and paranoia. Heart rate goes up. That's something that is a bad experience, and it has happened to many people, but nobody talks about it.
Right.
So do you know about the greening effect?
I have not, no.
They've done a lot of research about it, and it's very common, especially among beginner users who don't know. They mostly have been drinking alcohol socially, and now they mix it.
Yeah. Wow.
Yeah, it's a whole other level. And then there's the, from my experience working with younger people, the medical program, you have to be at least 18 to be a medical patient. In the recreational world, you have to be 21. Well, 18 to 21, that's still a big part of someone's life where their brain is still developing.
Right.
And so to just think that it's okay to just go to a dispensary and buy whatever you want and medicate yourself however you want without any guidance is a little bit dangerous, especially for the younger ones. They tend to think that it's okay to get in the car, drive down the road while they're smoking. Well, that's not legal. That's illegal.
Absolutely. And to be very clear, it's a medication for so many people. You wouldn't want to encourage, for instance, if you had a patient taking like an anxiety medication, something like Xanax, to pop a Xanax and then go drive and operate heavier machinery. Absolutely not. It impacts our cognitions, it impacts our reaction time, it impacts our ability to make critical decisions. And that is also true of cannabis, that just because it's seen as maybe a less harmful drug to some compared to alcohol, compared to opioids, compared to other substances, does not mean that it can cause tremendous harm if used irresponsibly. And especially when we have, you know, access to extremely potent doses like the cartridges, for instance, or waxes. That is very dangerous because it has a stronger effect, which could, in some ways, increase the likelihood of an adverse effect if you are self-medicating and not really thinking about what are those other consequences? What are the things I don't know that I don't know? And adolescents, they have a tendency to think that they're invincible, that we can bounce back from everything.
Exactly.
And there are significant consequences that can result from getting a DUI, a DWI, from being charged with possession of drugs.
How do you feel about cannabis eventually being covered by insurance? Is that something that you've thought about?
I've had conversations with some clients who are cannabis users, both medical patients and non-medical patients, and it's hard to say. On the one hand, I think it is a wonderful thing that insurance would be able to subsidize these medications, particularly thinking about where we're located, where in New Mexico, some people have to make decisions about, do I go out and get my prescriptions, or do I pay my water bill? Do I buy groceries? And so to be able to have insurance cover that, so that way it's not adding an extra cost, an extra stressor to the patient, I think that's a wonderful thing. And at the same time, I also am a little bit afraid for the potential for abuse of the system by bad faith actors, where we see right now, you can go get a medical card, they advertise it for like $25, but then they never follow back up with that person. They don't receive that guidance, that education, the training to identify what is the therapeutic dose for themselves. And so for that way, I think it can be both. It can be both a great benefit and another tool for harm.
Yeah, I mean, in my ideal world, and if everything was ideal, I would say that having access to growing your own would be a little bit more culturally acceptable, because in the Hispanic culture, herbs are a very common part of our culture, and growing your own with education, you can really learn about the value of the whole plant, not just smoking it. And remember, this plant has been around for thousands of years, and it was not smoked originally. It was eaten. It was used topically. It was used with oil. And there's evidence of that in the Old Testament, of it being an anointing oil. So now, the level of cannabinoids in the plant have to be addressed. This is not just something for fun. The negative side, the experiences that some patients have on the negative side are increased heart rate, paranoia, sweating, the uncomfortable kinds of side effects.
Psychosis, hallucinations.
Yes.
Absolutely.
Yeah, so I don't know about insurance getting involved. I don't think it's a great idea for the possibility of abusing the system. I think there's more education needs to happen just about what is the plant? What are all of the benefits of all of the plant, not just smoking it? I mean, I understand that smoking is the quickest way to get an effect, but it's still harmful to your lungs.
Yeah, you're inhaling an irritant, that you're burning carcinogens and intaking those into your body. And there is well-documented research about the health consequences and impact of intaking carcinogens in our bodies.
And when you said earlier about sometimes young people think they're invincible, and so when they're 20 years old, they might not have lung issues, but if you smoke it all the time, and if you smoke cartridges, you're doing more damage to your lungs. By the time you're 40, 50, you will have lung damage. That's the reality of it. So I'm honored to interview you, because I've gotten to know you, and I know that you're very passionate about the Hispanic community and sharing information in Spanish, which the community needs, and also that you are going to be a clinical psychologist with possibly prescribing abilities. And that is going to, that's going to give patients a whole other level of health care, mental health care, that they don't have now.
Correct, yeah. And so prescribing psychologist, for those who do not know, is licensed psychologists. So they've completed their PhD, and then they've gone on to get additional training. So they've gotten another master's degree. They've done more studies, more research, training to be able to prescribe medications, not just cannabis, but psychotropic medications. And that is a wonderful way to alleviate some of the burdens on these healthcare systems, where sometimes patients have to wait 3, 6, 9, even longer, over a year to go see a psychiatrist because there are so few providers. And so as a mental health care provider, to be able to take away one extra step for my patients, that's a very wonderful tool. And so I hope once I complete my education and get licensed, that if that is within the possibility of becoming a prescribing psychologist, I would love to take advantage of that opportunity if it arose.
Yes, that would be wonderful. Now, the other question I have for you is, what is your experience, or what would you like to share about the level of support that mental health practitioners are willing to do today for cannabis patients? I know some of them are a little bit hesitant, and they think of it as a possibility of another drug that the patient might be addicted to. So what is your experience of that, talking to other practitioners?
It's very polarizing. There's a lot of stigma that exists today still about cannabis use. Within the Diagnostic and Statistic Manual, so the magical book that psychologists, psychiatrists might use to look at diagnosing a mental health disorder, cannabis use disorder is there. Cannabis withdrawal, cannabis intoxication, other substances. And so there is
hyperemesis.
Yes. So there is a lot of both historical and current barriers to having these conversations for a variety of reasons. And in some cases, people are afraid to talk about these topics because of the potential social consequences, the potential consequences to maybe their business, to their well-being, in addition to just, the stress of confronting a topic that invokes a lot of feelings in people for a variety of reasons. And so my understanding is, mental health clinicians, when they're working in that therapy setting, that many are open to talking about cannabis use and exploring what that use and looks like with their clients. I don't know how much I don't think very many providers would be comfortable disclosing or sharing kind of what their experiences are with their clients. There's a lot of research talking about not making the therapy session about yourself, but some providers might share parts of that identity, part of their experience with their clients, to help build that rapport, to build that connection, that trust, to help educate their patients on the importance of being informed and holding a space to talk about it where maybe the client, the patient, doesn't feel comfortable talking with their family members. And there is that security and confidentiality and HIPAA to protect those records. But even so, many clinicians are still afraid to go into those conversations because it might be outside of their scope of their competencies. They might have their own personal beliefs or biases or assumptions that it's a drug, there's no therapeutic benefit, and so they might even shut that down. And so it goes both ways.
In your education so far, have you been exposed to cannabis education of some kind?
Absolutely. So at New Mexico State, one of the classes that we take for our PhD program is addictions. And so we talk about cannabis use. We talk about cannabis use disorder. We talk about, there's AA for Alcoholics Anonymous, but there's also NA, Narcotics Anonymous. There's people that in the program talked about a harm reduction model. So looking at cannabis as a way to get off of opioids, for instance. Yeah. And we also have a psychopharmacology class. So we talk about cannabis use and biological, biopsychosocial interactions of cannabinoids, THC within our bodies. So we do get education and training. And then of course, if folks were to go along and receive that education to become a prescribing psychologist, it gets a lot more education about that too. However, it's not necessarily a focal point of mental health training programs. And usually when it is included, it's much more talked about within the addictions and usually just within the addiction realm.
Do you think it would be beneficial for kids to be exposed to mental health care in junior high, elementary school, junior high school, because from the past experience with the war on drugs, it was not conducive to educating the young minds. And now I kind of see that kids need mental health care. They need it at a young age. We don't know what's going on in their homes. We don't know if there's abuse. We don't know if there's alcoholism. We don't know. And they are not telling. They often go and find cannabis as a way to cope with what's going on in their lives. Do you think that somehow in the educational model there was room for teaching the kids the value of mental health care?
Absolutely. So I want to make sure I distinguish. So I believe with 100% of my heart and soul that educating young adults, youth, children about mental health is critical right now. We have movies like Inside Out, and I believe Inside Out 2 is coming out tomorrow, I think.
Wow.
It's an entire movie about emotions and emotion management.
Yes.
And that is really important to start exposing younger minds to mental health care, mental health treatment. So that way, as they continue to grow up, they can develop emotion regulation skills. They can develop critical thinking skills to maybe say, no, I don't want to go to this party right now. I do want to be studying. I want to go to college. And if I'm partying and using substances, that's not going to help me accomplish that goal.
Exactly.
I don't know about if there's like a magical age or a timeline of when would be appropriate to start educating about cannabis. That's something that I would defer to the research and something I don't know enough about yet. But it's very clear to me in my experience that educating children, parents, and families about mental health is really important. As I said earlier, everybody should have a therapist.
And do you think it's lacking now? I mean, would you agree that it is?
Absolutely. The research shows that it's lacking, that typically when people are coming to a therapist, it's not out of a proactive move. It's about addressing presenting concern that is causing disruption to their ability to function daily.
Yeah.
Especially when I would see the adolescents and youth in the inpatient hospital settings, they got there because of their parents would bring them there.
Yeah.
And most of the time they didn't want to be there themselves. However, many children, many youth found it a little bit helpful to talk to somebody else outside the family,
Yes.
to have somebody who would listen, that would not provide judgment,
Yeah.
that would validate their experiences and the stress of what it is to go through in their shoes.
So, on a personal note, what inspired you to go into mental health?
It was not having access to a mental health clinician that I felt I could connect with and trust to talk about my own struggles kind of developing and going through life. And so recognizing when I connected with that first therapist who we clicked and it felt comfortable, I felt safe to be vulnerable, to share the good, the bad, the ugly. It was a transformative experience. And not only that, it emboldened me to go beyond just wanting to be a mental health provider, but to incorporate the other gift I was given, which was speaking Spanish, because there's a critical shortage of bilingual mental health clinicians or even bilingual healthcare providers.
Yeah,
and so to me, it became a goal. When I was in college, I had a professor who she attended my senior thesis defense for my psychology class. I made the mistake. I bit off more than I could chew. I thought it would be great to, in the spring semester, not have any classes, so I'll try and do both my theses in the fall term. So my Spanish thesis and my psychology thesis. That was a terrible idea. I was far too stressed. And so I had to make a choice. And so I focused on my psychology thesis at that time and went back and did my Spanish thesis in the spring. And so part of having the grace from that professor was having her come watch what I was doing. And so as she watched me present my thesis and topic, it's a little bit unrelated to what we're currently talking about. It was about criminal psychology, forensic psychology. What she took away from that was, wow, Jordan, you have a very strong gift for taking these topics that could be scary, that could evoke strong feelings, and making them friendly, invitable, approachable. Have you ever thought about blending that with Spanish? No, I had not. Spanish is my second language, so I was always a little bit insecure and lacking in confidence of speaking because it wasn't my native language. But ever since that comment, it sparked and ignited a drive, a hunger to really reflect and do something about it. And then once I was going through my master's program, that's when now I was consuming the research and seeing, wow, there is massive gaps and differences between the access of those who speak English to healthcare providers and those who are primarily Spanish speaking or bilingual, and then access to healthcare.
And to add to that, culturally speaking, dealing with the Hispanic culture adolescent compared to a Americanized adolescent, you're dealing with different roots and different. I mean, the Hispanic culture tends to be a little bit more reserved. They don't talk about things.
No le ponemos la ropa sucia al aire para los vecinos que ven. Like, we don't air out our dirty laundry for the neighbors to see.
Exactly, and I see that in the patients that I work with. They're more reserved, and they are not as willing to talk about issues that are going on at home, which is why I see a lot of the younger Hispanic kids gravitating towards the use of drugs at a very young age, because now they're being Americanized and the culture at home is different. So yeah, the need for mental health care is, it's very needed.
It's very needed. It's firmly established in peer-reviewed research, and I appreciate you bringing up that distinction. Counseling a Hispanic teenager is very different than counseling somebody from the U.S. who maybe is not a first generation or second generation. There are cultural differences, there are racial differences in terms of family values, beliefs, the stigma of mental health care. That's pretty ubiquitous kind of globally, that we don't talk about our feelings, or at least in my experience with men, it's only socially acceptable to display a few emotions, like anger and happiness.
Yeah. The thing I'd like to finish with is that there are very few practitioners of your caliber with Spanish as a second language, with your appreciation for serving the patient's needs. And I just want you to kind of give us a last final something that you want to share to the community on why mental health is so important to pursue.
Well, I really appreciate your kind words. I am humbled to be again a part of this interview and to be able to speak as a mental health kind of expert on this topic. And so if I were to give our listeners a takeaway message, it is that it is okay to not be okay. That having a therapist, working with a counselor, a psychologist, a psychiatrist is no different than working with your physical primary health physician or a nurse. It is important. We are social creatures. We are meant to be working together within groups with others. And there's a lot of benefits that can come from speaking to somebody who has the training about mental health conditions. There's a lot of benefits to having somebody who is going to provide you that unconditional positive regard and support. And so if you were to go and seek out some mental health resources or start working with a therapist, note that just because they're the therapist, that they're working with you, that they might have a specialized therapeutic modality or approach, one of the most important features of working with a mental health clinician is that trust and that relationship, that rapport.
Yep.
And so sometimes that first person that you see might not be a good fit, and that's okay. And you can say no, maybe this isn't going to work out. Do you have any referrals to another clinician that might be available to work with me? Because it is really important to have that trust and that relationship, especially when we're confronting conversations and wanting to talk about something like maybe our use of cannabis and how it maybe is hindering us reaching our goals, or how it is helping us alleviate pain. And so for those who are on the fence about going to see a therapist, I would encourage you to lean into that discomfort. The one thing that I keep being told in the program is to trust the process, to trust therapy, to trust that this healthcare provider will be looking out for your best interest. And that just because you're seeing this therapist and maybe it's not working doesn't mean you have to stay. You should absolutely look for other providers. And that can be challenging in an environment like this, especially where there's not a lot of bilingual clinicians. And so I would say, don't give up hope. That keep searching. And one of my favorite quotes that I would give my clients is, it's okay that you don't have that hope or that belief today. I'll hold on to that for you. And then when you're ready, I'll give it back.
Perfect. So I want to say that I want to wish you well, first of all, in your new environment in Rochester. And I personally would love for you to come back. So you have a home here. Mi casa es tu casa. And you would be an asset to our community if you were, wherever you are, but I hope you return here. And thank you for taking the time to share who you are and what you do. And let's do this again. During your time in Rochester, we can always catch up on Zoom and continue learning what you're going through and what you're learning.
Well, thank you so much, Dr. Chavez. I hope to be able to return. There is something to be said about the spiritual benefits, the physical benefits of the big blue skies, the mountains. The heat is a little rough in the summer.
Yeah.
However, it's really nice to be able to go out and go for a walk on January, when normally in my hometown it would be like -50.
Right, with
And
4 feet of snow or something.
Exactly.
Yeah.
So I'm honored and humbled to be able to take part of this conversation, and I look forward to continuing this conversation.
Yes.
Whether I'm in Rochester or wherever else this journey takes me.
Well, you got to live in the land of enchantment for the last 4 years, and you are an enchanting being that brings so much to any person who will benefit from your services. So thank you again for everything that you do and everything that you will do, and come back and see us.
Absolutely. I will do that, Dr. Chavez. Thank you so much.
Thank you.